These rural areas are losing access to healthcare, but in a broader national sense, they are not being flagged as in need of attention. So my research centers around the closure of the labor and delivery unit at Windham Community Hospital in Willimantic, Connecticut. It looks at community, legislative, leadership, healthcare provider perspectives on the closure and their impact on health-seeking behavior throughout the healthcare system as a whole. My coursework in anthropology led me to an understanding of different healthcare disparities across the country and around the world, as well as different modalities of thinking around deservingness of care and other associated theories. In 2020, Windham Community Hospital decided to suspend their labor and delivery services due to the COVID-19 pandemic. But the Office of Health Strategy at the state of Connecticut ended up intervening. Hartford Healthcare determined that they did not have enough staff to keep the labor and delivery unit open, as a unit of that nature requires nearly 24/7 coverage by an obstetric physician. There is that 20% of births that do require advanced care, typically in an ICU or NICU setting. Hartford Healthcare now directs patients who are in need of labor and delivery services to Bacchus Hospital in Norwich. I chose to shift my focus to speaking with community leaders, community organizers, and state leaders to focus on their perspectives of Willimantic as a maternal healthcare desert, because these are the people that are making decisions either within the hospital, on the level of the town, or on the level of the state. What we're seeing so far is that members of the community perceive the fact that folks have to travel to Norwich or to Hartford or even to Manchester as unsafe. That factor lowers the quality of care that people perceive that Windham Community Hospital is able to provide. Particularly in developed countries, we're seeing an overall loss of healthcare services in rural areas, and we're particularly seeing this lack of maternal healthcare. There is definitely a sense of fear and uncertainty surrounding what the process of giving birth in Willimantic is now that there's no labor and delivery unit at Windham Hospital. I'm planning on going into public health practice, and I want to gain a better understanding of how healthcare functions in Connecticut. The Yukon Humanities Institute has played a key role in helping me develop my research and work through the research process. It has provided a space where myself and the other scholars can work with our advisor and work with each other to iron out issues that have occurred in our research, and also just to discuss the status of academia in general and how our research and us as emerging professionals fits into that picture. Having a community of fellow researchers is incredibly important when you're conducting a project like this, especially when you're a student who this may be your first time conducting this type of research. Regardless of whether their topic is in any way related to yours, it's given me that space and that community.